Hello and thank you for joining us today. You've joined us for a session that offers an introduction to caring for somebody transitioning from hospital to home. Our goal for the session today is to equip you with an understanding of the hospital discharge process, your rights as a carer, and the support available to you. We aim to help you navigate the intricacies of the healthcare system. It's not easy to get around, and gain an understanding of the roles and responsibilities of professionals within the hospital setting. Remember, you're not alone on this journey, and we are here to ensure that you receive the support that you require. So let's get started. We're going to explore several key areas that are crucial when transitioning from hospital care to care at home. So firstly, we're going to start with an understanding of the process of moving from hospital to home and provide a step-by-step guide of NHS Lothian's Discharge and Transfer Policy 2022. Next, we'll delve into your rights and choices as a carer under the Carers Scotland Act 2016, ensuring that you're fully aware of what you're entitled to and the decisions that you can make. We'll then have a look at identifying roles in the hospital environment, a look at who's who to demystify some of the complex hospital jargon that can sometimes be really difficult to navigate. We'll also discuss the importance of confidentiality in a hospital setting. And then we'll have a look at a bit of a checklist to support you to stay informed and on track, during that hospital discharge process. Next, we'll look at some of those longer term options that you might want to consider, when thinking about your next steps or during the transition. And finally, we'll guide you on where to get help. And the session should roughly take around 25 minutes. So please do make yourself comfortable. So let's get stuck into that discharge policy. So, upon admission, within 24 hours, a comprehensive treatment plan should be established for each patient. And this includes necessary tests, therapies, and other interventions to ensure a smooth and timely discharge. The team will set an estimated discharge date early on in admission, and this date is based on the anticipated time that it will take to carry out the treatment that is required for the person that you care for to be medically fit for discharge. The estimated discharge date should be communicated to the patient, their carers, and the family. And the hospital aims to clarify goals and expectations with the patient and their carer to prevent miscommunication and mismatched expectations, which could delay discharge. At this point as well, patients and their carers should receive what is called the Leaving Hospital, a guide to discharge planning for relatives and carers booklet. So please do check in to make sure that you receive that. And in line with NHS Lothian's discharge policy, a patient's discharge should always proceed with the agreement of a carer. So what should be happening during admission? So patients, carers, and when appropriate family members should be actively involved in discharge planning process. And this ensures that everybody is well informed and can effectively participate in the discharge or transfer procedure. Any changes to the treatment plan or discharge date should be promptly communicated to the patient and carers. This makes sure that everyone is kept in the loop, updated, and in line with the current plan of care. A key step in this process is assessing whether a patient is medically ready for discharge and identifying any support they might need at home. The estimated date of discharge should be proactively managed and shared with patients and carers at all stages. This helps to ensure that everyone can prepare adequately for the transition from hospital to home. Transportation needs for leaving the hospital should be discussed as part of the discharge planning process. And lastly, it's beneficial to either update existing care plans or initiate new ones focused on anticipatory care or self-management plans, because this promotes continued health and well-being after discharge. But what does this mean? An anticipatory care plan is a proactive, personalised plan created with healthcare professionals to outline a patient's future care preferences and needs, aiming to help them manage long-term health conditions and prevent crisis. A self-management plan is a personalised guide that helps individuals manage their health conditions independently. And it outlines daily routines, medication schedules, and strategies to help symptoms and manage emergencies. To make sure that the hospital has everything in place for the discharge of a patient and their carer and any other service providers that will be involved, they must have the following in place 24 hours before discharge. The hospital must confirm discharge arrangements for the patient, carer and service providers to ensure that everybody is informed and prepared for discharge. The hospital must confirm transportation to ensure a seamless transition home. They must order all necessary medication from the pharmacy. And if applicable, they should provide what's called a fit note. Sometimes we know this as a sick line. And they must also provide instruction on how to use any equipment or medical aids being supplied. This is all about promoting safety, empowering patients and carers, and facilitating their recovery. And lastly, they must also consider at this point what community resources are required to support the patient's recovery journey when they go home. So on the day of discharge, you and the person that you care for should expect the following. The hospital should confirm all discharge arrangements for the patient, carer, and the service providers that are going to be involved verbally and in written format. A copy of the care plan should be provided, and appropriate transport should be in place. Medication should also be dispensed for the person that you care for, and it's handy to know under the safe use of medicines policy, there's an expectation that a patient should go home with a minimum of 14 days medication. A discharge letter should be sent to the GP of the person that you care for within 24 hours. And any aids and equipment should be provided. The necessary support should be in place for discharge, and you should also be told about any follow-up medical appointments and referrals made to community services. So for example, physiotherapists, district nurses, and occupational therapy, for example. So what we've just done is reviewed briefly an overview of the NHS Lothian Discharge and Transfer Policy 2022. Please know though that you can request a copy of this from any hospital or access it online at NHS Lothian Policy Online. Under the Carers Scotland Act 2016, carers are granted significant rights in relation to the hospital discharge process of the person that they care for. And these rights are outlined in the Carers Charter, which you can find online on the Scottish Government website. Because carers have the right to be involved in the discharge process of the person that they care for. And what this means is that if the person that you're caring for is admitted to hospital, health boards must take appropriate steps to involve you in the discharge process. And there's three key things to consider. Health boards must inform you as soon as possible about when the person that you care for is to be discharged from hospital. Your views must be taken into account when planning the discharge as long as it's reasonable and practicable. And lastly, you should be invited to share your thoughts about the discharge of the person that you care for. It's important to remember that these rights apply whether the person that you are caring for is moving from hospital to home, or whether they're moving from hospital into a care home or another NHS facility for further treatment or rehabilitation, or in the case of mental health patients, to a lower security hospital. It's the responsibility of the health board discharging the person you are caring for to involve you in the hospital discharge process. And it's really important that early conversations are held with health and social care professionals so they can help you plan for appropriate support to be put in place for you and the person that you care for following discharge. And these provisions are really important because what they ensure is that the carers are supported and their views are respected during the discharge process, helping to improve, carers' health and well-being so you can continue to care if you wish so, and also to have a life alongside caring. So knowing your rights is important, but so is understanding who's involved in the care process whilst the person that you care for is in hospital, and how to contact them, as there are many professionals that contribute to the care of the person that you care for. So finding the right person to talk to can help address your concerns. So it's important to familiarise yourself with the different roles in a hospital setting and what their responsibilities are, because this knowledge can make a real difference in communication and make things more effective and inevitably less stressful. So first up, we have the multidisciplinary team. And the MDT, as it's often referred to, is a group of professionals, including medical staff, nurses, and social care service staff, that is tailored to each patient need. So it's very different each time the person goes into hospital. And they play a crucial role in the discharge planning process, ensuring the smooth communication and coordination of care. This team also identifies when a case conference or a discharge planning meeting is needed, especially for complex discharges or when there's been significant changes in health or social care needs of the person that you care for. And the MDT ensures timely referrals to other professionals and plans tests to avoid treatment delays and discharge. Carers are and should be seen as equal partners in care and valued participants in this process, and your insights and involvement help ensure a smooth transition from hospital to home. Next up, we've got the lead consultant, and the lead consultant assesses a patient's readiness for discharge and collaborates with that multidisciplinary team for planning. And the consultant informs the multidisciplinary team of the expected discharge date, so they can facilitate the planning. The consultant ensures that discharge documentation is completed promptly. They are also responsible for ordering medication, and they provide the discharge summary and ensure that it's sent to the person that you care for's GP on day of discharge. And the charge nurse. In hospital settings, nursing staff, particularly the patients, the person that you care for's assigned nurse, plays a pivotal role in discharge planning. And this nurse ensures that the patient receives their medication and follow-up instructions for discharge, for their patients, their carers, and their relatives, and they communicate any concerns with the lead consultant and the multidisciplinary team. So these are a key player and somebody that's really important to identify yourself as a carer too and to communicate with. So allied health professionals are often referred to as AHPs, and they're a diverse group of healthcare experts who are dedicated to improving the quality of life for people of all ages in all settings. And they work across various sectors, including health, education, and social care. And they use their unique skills and knowledge to diagnose, treat, and rehabilitate patients, and they play a key role in helping people live healthy, active, and independent lives. When it comes to transitioning from hospital to home, allied health professionals are key, and they work hand in hand with patient, their families, carers, and any other healthcare professionals to plan and coordinate the patient's discharge from hospital to home and make sure they're getting any subsequent care. And their ultimate goal is to help patients regain their independence and enhance their quality of life. So let's have a look at them. So first up, we've got the physiotherapist. And a physiotherapist is a healthcare professional who helps people affected by illness, injury, or disability through movement and exercise, manual therapy, education, and advice. And when it comes to the transition from hospital home, physiotherapies play a key and crucial role. Their goal is to help patients regain their independence and enhance their quality of life. And they do this by helping patients with their physical rehabilitation, providing education on how to manage their condition, and coordinating with other healthcare professionals to ensure a smooth and safe transition of care from hospital to home. And next up, we've got the occupational therapist, or OT for short. You'll often hear them called that. And they are a healthcare professional who assists people who are having difficulty with everyday tasks due to injury, illness, disability, or significant life changes. When a patient is transitioning from hospital to home, the role of an OT becomes even more critical. OTs help people regain their confidence, especially after a long-term hospital stay. and they teach new ways of doing everyday tasks, and they provide advice on managing fatigue or pain and recommend equipment to help patients continue their daily lives independently. Moreover, they play a really key role in preventing falls by suggesting modifications to the home environment and advising how to maintain health, strength and abilities. In essence, OTs are the bridge that help patients transition smoothly from hospital care to home care, ensuring that they can live their lives to the fullest. Next up, we've got the dietitian. And they are a healthcare professional who plays a crucial role in patient care, both in the hospital and when transitioning to home. In the hospital, dietitians assess and treat nutritional and dietary issues. They also consider the impact of acute or chronic conditions on someone's nutritional status. And what they'll do is they'll work with patients to develop a treatment plan that helps them meet their goals. So for example, when a patient is ready to go home, a dietitian's role doesn't end, and they continue to provide support and person-centered care, especially for those who might be struggling to meet their nutritional needs. So maybe, for example, people that are struggling to maintain their weight because they're not able to swallow, for example. So in summary, dietitians in Scotland are really essential in ensuring patients receive the right nutritional care from hospital to their home so that they can recover to their fullest. And last up, we've got social workers. And social workers are really essential in the hospital discharge process because what they do is evaluate the patient's long-term care needs to ensure that they get access to the services that they are entitled to. And they work closely with healthcare professionals to create a dedicated discharge plan that should support the patient to transition from hospital to home or another care setting safely. They also assist families and carers in adjusting to the patient's illness and accessing resources. And additionally, they can also help with legal measures and make sure that things are in place for patients who lack capacity or advocate in their best interest. So now let's have a look at understanding confidentiality. Patient consent is crucial for sharing information while keeping it confidential. Carers should know that sharing information without consent can lead to serious consequences for health and social care staff. So clear conversation about consent is really essential. Many carers don't realise that consent is needed before sharing details between carers, patients and healthcare staff. So it's really important that these conversations about consent and confidentiality are held at a really early stage. But what information can be shared? So with patient consent, this is the most straightforward situation, is when a patient, the person that you care for, gives explicit consent for their information to be shared. This consent should ideally be documented for future reference, making it easier for everybody involved. But what I would say is even if a patient doesn't give consent, healthcare staff can still share general information about illness, medication, or support for you as a carer in your own right, because this doesn't break patient confidentiality. And we'll come on to that in a little bit more detail. So as a carer, you can make sure that you still get all the information that you need to look after the person that you care for. The hospital can also share information in the patient's best interest. So if the person that you care for is unable to give consent due to their health condition, healthcare staff may still decide to share information if they believe it is in the patient's best interest. This could be the case when a carer needs certain information to provide appropriate care, and this often applies in hospital settings. Coming back to general information, healthcare professionals can share general information about illness, medication and support for carers without breaking patient confidentiality. And this allows the carer to better understand the patient's situation and conditions and provide effective care. The hospital can also share information in emergency situations when immediate decisions about treatment need to be made. In these situations, healthcare professionals may share information with the carer if the patient is unable to make decisions for themselves in these situations. In some circumstances as well, you may have power of attorney or legal guardianship for the person that you care for. And it's really important to let the staff at the hospital know if you have any legal measurements in place to help aid with communication and information sharing. If you don't have power of attorney in place, and would like more information, please do reach out to Vocal and we can support you to explore this in more detail. So remember, whilst patient information is paramount, the role of a carer is also vital. Therefore, it's important to strike that balance between respecting the patient's privacy, the person that you care for, but also ensuring that you as the carer have the necessary information to provide effective care. So during the hospital admission, there's a lot happening and it's easy to overlook important tasks and questions. So here's a straightforward, simple checklist to help guide you. But for a more comprehensive checklist, I would maybe consider looking out the Coming Out of Hospital guide provided by Carers UK Scotland on their website. And this will ensure that you're fully prepared and equipped for the discharge process. So first off, speak to hospital staff and let them know that you are the carer for the person that is in hospital and how they can contact you. Really important that you do this very early on. Speak to the charge nurse and let them know, for example, I am the main carer for my relative or friend. Here's how you can reach me for any updates on care and discharge. This is the support I provide at home. Secure consent. Speak to the person that you care for to get their consent to discuss their care and treatment with staff. You could say something like, it's really important that we discuss your treatment and plans with the medical team, including the nurse or someone from the multidisciplinary team responsible for discharge, so I can best support you. Are you comfortable with this? Make sure that you ask questions about the hospital discharge process and what's going to entail, what care is going to be required when the person you care for goes home. Let staff know what you are willing and able to do when the person you care for goes home. So during discharge discussions, ask staff about more information so you can understand what care will be needed at home and advise them what you are prepared to provide and what you are not prepared to provide, and what information that you require to provide the support that's expected. And prepare for post-discharge care. So following on from what we've just discussed, ensure that you have all the relevant information to provide the care that's required confidently for the person that you care for. So you might want to say to the hospital staff, to provide care confidently at home after discharge, I need all the relevant information and instructions. Can you please ensure that I have all of this information before discharge? So hospital admissions can often be a catalyst for change, and it's helpful to have a regroup and think about what your next steps are. This could also mean looking at what long-term support options are available to you to help sustain your caring role longer term. So first up, we've got income maximisation. Have a look at your welfare right entitlement and see whether there's any other financial assistance that is available to you. Help at work. Do you need information about your rights as a carer at work, including flexible working and carers leave, for example? Adult carer support plans. If you're caring for an adult or a child, a support plan is a must. It outlines your role and identifies your needs to balance life and caring to ensure your own well-being. Also, if you have any children that are providing a caring role, they can also access a young carer statement. Training. Do you need more information to feel more confident in your caring role? So for example, information about dementia, information about power of attorney, moving and handling, and managing medication. Future planning. Do you need to consider power of attorney, wills, anticipatory care planning, and planning for emergencies? Making sure you get a break, making time for yourself and relaxation hobbies are crucial for healthy balance of maintaining your care and responsibilities in life. How are you going to get this? So while this journey is daunting, and can certainly appear that way when you're in it, remember that you're not alone and there's a wide range of support services available to assist you. If you're caring for somebody in Midlothian, know that Vocal Midlothian is here for you, and we have a dedicated hospital discharge service to assist you during the discharge process. And that's whether the person that you care for is going home or moving into long-term care. And the contact details are provided on this slide. In Edinburgh, the Health and Social Care team have a hospital discharge carer support service and a range of support workers that can help you from the moment the person that you care for is admitted to hospital. They can help you plan for the care after they leave, and somebody will contact you and connect with you with additional support and information about groups and short breaks, for example. And their contact details are also provided on this slide. Additionally, the Patient Advice and Support Service is an independent service offering free, accessible and confidential information and advice and support to patients, carers and their families that are dealing with NHS. And there's a range of support that they can offer. So they can provide information and advice and support for anybody who wants to give feedback, make comments, raise concerns or make a complaint about the care and treatment provided by NHS in Scotland. They can also help people understand their rights and responsibilities as a patient or a carer. They also work with NHS Scotland to help improve the healthcare provision. But if you're watching this recording from East or West Lothian, don't worry, you can still also access support from your local carer centre. So in West Lothian, your local carer service is Carers of West Lothian, and in East Lothian, this service is provided by Carers of East Lothian. Very originally named, as you can tell. Remember, you're not alone, and there's a lot of help here to support you every step of the way. Thank you very much for your time and attention today. If you have any additional questions or need further assistance, please don't hesitate to contact us using the information provided on this slide.